Hello, everyone. Good evening. We are live. I am going to just invite our guests. Um, oh, there you are. Hello, hello. Can you hear me, Kate?
Hi, I can indeed.
Fantastic. I'm just saying hi to everyone as we're joining. It's always the thing about Insta Lives. It's like you've got to kind of click around, hope people join. Don't want to be rude to anyone. Hey, Amanda. Okay, let me. It's saying.
Everything's so instantaneous, isn't it?
I know, I know. Let me just do one more invite. I saw. Okay, unable to join. Let's try now. There's load shedding. There's thunderstorms in Durban. It's
Sure.
definitely a moody evening. So hopefully everyone can join. Let's see. Hello, Cara, Chloe. Hello, Sam. Hello, Ndange. Sorry, I'm just reading out your handles. I don't know if that's your names or handles. It's very nice to have you on. Here we go. Oh, hello.
Hi.
Right. Let's get started because time is ticking. I want to introduce our incredible guests. So if you've just joined now, first of all, hello everyone. My name is Julie. I'm on the Embrace Hub team. This is the first Insta Live we have done in a while. And I'm really excited to get back into it because it's actually just such a nice thing to do at the end of the day is sort of have a chat. I'm aware that we're sort of sitting, the three of us are sitting kind of hopefully giving you our full attention, and you might be listening with one ear pod in the ear while putting a baby to sleep or finishing dinner or, I don't know, driving in your car and listening or whatever you're doing. We totally understand that busy multitasking mom life, but we're just so thrilled that you've got an ear open to this conversation and really hope you're going to participate, ask questions. Some of you have already asked questions anonymously, and I've got them on the side. I'm going to get to them as many of them as possible. Before I introduce my guests, just to say that tonight the conversation obviously is called Motherhood Embodied, and we really are wanting to have a very real, hopefully really relatable, relaxed in the sense that it's a Monday evening, but obviously you can ask your questions, conversation about motherhood, our sort of bodies as they kind of transition through motherhood, our bodies in relation to our self-esteem, in relation to intimacy, in relation to how we sort of feel about ourselves. And obviously, it's just such a privilege to have the two guests that I have tonight. So let me introduce them because they just have a wealth of expertise and experience, and they're as passionate about this topic as we are. And yeah, we really want this conversation to be, I guess, as a start about normalizing conversations like this. But this isn't just one. These are the conversations that you'll have them with your healthcare providers, that you'll have them with your friends, your family, and that the more we start talking about this, the more we kind of get to take away any of the stigma or the taboo around being honest about the kind of transitions our bodies go through as we journey into motherhood. So on my left, I don't know if you're seeing it on your left, but we've got Kayla Tess Pattenden. So Kayla Tess is a mom, wife, social worker. She spends her days in the therapy room counseling clients towards their best relationships with themselves and others. She's trained in a variety of therapeutic models, including couples and sex therapy. Kayla Tess is also one of our 2021 Embrace Mamanda Fellows. Welcome, Kayla Tess. So glad to have you on.
Yay! Thanks for having me, team.
Pleasure. And then to my right, we have Dr. Sibu Lubulwana. Dr. Sibu is a passionate OBGYN, mom of three, content creator, known as the Period Mom Doc. She's a firm advocate for normalizing menstruation and keeping girls in school. Dr. Sibu uses her expertise as an OBGYN on social media to answer questions about pregnancy, sex, reproductive health, and infertility. It's an absolute honor to have you with us, Dr. Sibu. Thank you so much for making the time.
Thank you so much for inviting me. I'm so glad to be a part of this.
As I said at the start, and I'll say it again, welcome to people who've joined. I'm seeing your names. Guys, I'm terrible with tech and multitasking, so I'm going to try my best to be seeing the kind of comments that you put in the question box. If I haven't answered your question or come to you straight away, feel free to retype it. I'll do my best. This really is, obviously, we're going to be leading a conversation. We've got some questions kind of get us started. But if something is sort of on your mind, a comment or a question that you'd like to share, please do. It's wonderful for us to feel like we are having a conversation with you. So say hi to other people that you spot online, if you spot your friends. We will obviously be saving this video and uploading it onto some of our other platforms for people who aren't on Instagram tonight. So it will be every piece of content. But of course, if you're here live now, you get to ask a question to our panel. So I wanted to start in the spirit of kind of getting us all onto the same page. Dr. Sibu, I'm wondering if you can help us make sure that we get our language correct, because I think language is really powerful. And I know I grew up, well, when I was a child, I called a vagina a cookie. And we had like a number of like kind of, I suppose, quote unquote cute, but probably a little bit creepy names for private parts. And I think I don't know how old I was, but it wasn't that long ago that I started hearing terminology like vulva being different from vagina. And I think as we talk about anatomy, it's really helpful to kind of make sure that we're all kind of using the same language. So can you talk us through, we're looking specifically at, I guess, the female reproductive organs.
Yeah.
What have we got? What are the main bits?
Yeah. So we all used to just calling it lady bits or cookie, as you say. Even in our sort of African languages, we use other words other than what it actually is. And it's, in a way, we taught that you don't call it what it is because you're respecting the private part, or, you know, for one reason or another, but everybody just chooses to call it another name. And in a way, maybe it's to make it less shameful, if I can put it that way as well. Whereas, I mean, we call a nose, lips, eyes. So why not call our sexual organs what each part actually is? You know, it's one of actually my areas that I love to talk about, because it's important for women to be able to express themselves clearly and honestly. And if you can't name your vagina, if you can't call it a vagina, if you can't say what's the difference between a vulva and a vagina, then it becomes difficult for you to even say if you've got an issue in that area. You know, some people call it the area even. So it becomes difficult to communicate what the issue actually is and where the issue is. So on the outside, we have the vulva. So the vulva is the part that has the skin, that has the pubic hair, and it's got the lips that are on the outside. So from the pubic bone going down, and that's the vulva, basically. It's got the labia, the big labia, and the small labia. And on the inside, I'll just take my model here that's going to help us to sort of maybe say, sorry, I'm in the dark. We just had a huge thunderstorm in KZN and our lights are out. So it looks a bit dark, but yeah. And then on the inside is the vagina. So the vagina has got this mucosal layer, and it's a canal. It's got a lining that produces, it's got glands that produce mucus, that produce fluid, which is why we have the physiological discharge that we have as women. So it's normal to have that discharge as well on the inside. And then up from the vagina, then we get the most bottom part of the uterus, the womb, which is the cervix, which is where we check for pap smear, and then the whole womb, and then the ovaries on the side, and the fallopian tubes. So this is our genital tract, basically. The only thing that you won't see on this model is the vulva, which is the outside covering with the skin and the pubic hair as well. And that's the vulva. So I know once my sister, I was on radio and I was talking about, they were asking me how you clean your vagina. And I said, well, you don't clean your vagina. It's self-cleansing. And my sister was mortified. She's like, how could you say that on national radio, that you do not clean your vagina? I said, yes. perhaps I should have been more clear that the vagina, the canal on the inside, you don't clean, but the vulva, you can clean with water and a cloth. So yeah, it just showed, and my sister is a teacher, you know, so, but she still couldn't make out the difference between a vulva and a vagina, you know.
And then I don't know if it shows on that model. That was incredibly helpful. And I think access to even models that you can look at like that is just something that we should have more access to, because it is fascinating, and you like have no clue how your body is all necessarily interlinked if you don't have someone kind of explain it to you like this. The clitoris, where is that in relation to what you've shown? I don't know if it's on the model, because that looks like
no.
Yeah, can you
unfortunately, it's not on the model, because this is more the inside, so it will be on the outside as well. So we have 3 holes, as opposed to guys who will have like 2 holes, so to speak. So we have the urethra, which is where the urine comes from, and then after that, at the bottom, we have the vagina, and then we have the anal canal. So the clitoris is just above the urethra, and it's covered by like a V type of covering, like the clitoral hood. So it protects it because it's quite a highly innervated area, and it's quite sensitive and erogenous. So we've got the clitoral hood that covers it, and then we've got that sort of like a teepee type of a thing under the clitoral hood, and that's your clitoris. And then below it is the urethra and the vaginal canal and the anal canal.
Fantastic. Thank you. That's really helpful. And I'm sure we're going to kind of get, when we kind of speak to Katie more around kind of how these body parts all kind of work. I will say that, and I'm going to potentially embarrass myself, but this is a shame-free space. So I'm going to try and I'm going to try and model that vulnerability. I don't know how old I was when I don't think I could have told you for a very, very long time exactly like where my urethra was. It just wasn't, like urethra compared to vagina, like it just, it just wasn't something that I had any knowledge on, and there was no real picture or anything I remember seeing that sort of made sense. And I do think, yes.
Do you mind if I comment there quickly?
Yes, absolutely.
I think that what you've shared is incredibly relevant for us as women. But if I can just get amen in the chat to the fact that the men in our world also do not know the difference between our various orifices.
That is so true. And it's important that they know it, actually. It's highly important.
Yeah. So I wanted to, before we move over to a question for you, Katie, I want to just follow on one thread that you're saying, Dr. Sibu. So you were speaking about this, being on radio and talking about kind of cleaning, the vagina versus the vulva, and how you kind of got called up on this. I mean, it just, there was a whole Twitter thread, oh goodness, towards the end of last year, I think around a sort of a product that was being marketed effectively kind of, around freshening up your vagina, so that, because the assumption is, or at least the undercurrent message is, that vaginas are smelly and need to be made to smell a particular way in order to be desirable, or maybe not even desirable, but just acceptable. Where does this come from? We know it takes on a whole bunch of, different forms. You can have sort of products that you can get off the shelf that, promise to make you smell a particular way, the different types of scents available. Then there's sort of another sort of branch of it, which is like sort of more herbal and seen to be as more natural. I can see here, Kia is asking the question, is yoni steaming safe? Yoni steaming, I mean, the word yoni is coming up a lot on social media. We're definitely coming across a concept of of steaming your vagina as something that should be done on a regular basis definitely has become more public than I remember it ever being in years gone by. Is there any merit to it? Rachel's blaming the Kardashians. Kia's also asking, so more so the pearls that are inserted. Okay, so you're going to tell me about the pearls. I don't know about the pearls, but I know about the sort of douches and the herbal baths that you're supposed to sit over a bucket. What are those? Do we need them? Is there any merit to them?
Yeah. So, Rachel, I also heard recently about the Kardashians' vitamins for the vagina. So it's something that's come up recently. And yes, we've heard about the yoni steaming and the yoni pearls that you can put in there to clean your vagina. So it's and I get this asked this question a lot, and I always say that, well, I have to answer it from what I know, which is the scientific knowledge that we were taught. And firstly, it's what I just said, that the vagina is self-cleansing. It's made that way. That's why it produces the substances it produces and the commensal organisms that stay there. It's their home. And their duty is to make the vagina clean and to make it a certain pH where, everything works well. Yes, there will be times where that pH is disturbed, like maybe during your, just before your period, when there's some hormonal changes going on. So it may be disturbed and you may have an overgrowth of the fungal infection and get candida, or you may get one of the viruses like bacterial vaginosis grows over more than normal, in other words. But even that, if you correct your environment, if you correct how you're eating, if you correct your drinking habits and you drink lots of water, you have plain yogurts, that can correct itself even without needing any treatment. So you don't need to steam the vagina in order to clean it. You don't need to expose it to any pearls that normalize the pH, or that can, I've heard yoni steaming can even heal endometriosis, can heal infertility and all sorts of things, which, when you look at the mechanism of how infertility will come about, it does not make sense how steaming the vagina can actually heal infertility, because that will usually be either from tubes or from the ovary. So how steaming can help with that, it just beats me. How it can help with fibroids, it does not make sense, because those are all things that have a certain pathogenesis, how they come about. And so just steaming your vagina will not help in terms of fertility or in terms of fibroids or any of the symptoms that it's been claimed to help with.
Including pregnancy, because that's another one, when you're pregnant and after you've had your period. So it's not required for the kinds of times when it tends to come up as, when you're pregnant, steam your vagina before birth or maybe directly after birth. No.
Everything is the way it should be, and we're not supposed to be putting in any pearls or any steam in your vagina, because it cleans itself. If there is something that, there's different types of discharges, of course. So if there is like a green, yellow discharge that's foul smelling, then that's a pathological discharge that needs to be treated. But that will need antibiotics, not so much yoni steaming, because even that can actually increase your chances of getting infections, because even that steam, it makes the lining of the vagina to be sensitive, to be easily bruised, and that you can easily get STI, sexually transmitted infections. So it's not something that has been proven to help in any way.
So it's not even like, from what you're saying, it's not even like it's neutral. It can actually be harmful.
It can actually be harmful. Yeah.
Okay.
And that's why you end up depending on it to sort of make the vagina to be in a somewhat stable environment, or to be stable in that state, because you're consistently exposing it to things that it's not supposed to be exposed to. And so it changes the whole environment, and then you almost depend on it for any, well, what you are deeming as normalcy at that time. And the vagina is not supposed to be dry. It's supposed to have the discharge. It's a physiological discharge that we need for its normal function.
Thank you. That's incredibly helpful.
Could I ask a question on the back of that? Is that okay, Jules?
Yeah. Go.
So, Dr. Sibu, I'm obviously so conscious that the narrative on the street is that when we ask where these thought patterns came from, that the vagina didn't smell nice, it wasn't acceptable, using the words you used. Obviously, the narrative for many of us is to assume that that came from a masculine perception of the fembod. Is there any other reason beyond that that perhaps we need to understand in terms of the root or the understanding of, why do we actually perceive the vagina to actually be quite not shameful in the sort of psychological sense, but actually quite disgusting and not enjoyed? Is there root to that beyond just patriarchy, which I think we all love to talk about? Oh, she's gone.
I know, I'm seeing, sorry, I was about to just try and cut you off to say that I think we've lost Dr. Sibu. Let me see if we can, I'm wondering if she can ask to come back, because that was a really, I mean, it was a fantastic kind of question around where this all comes from and what, but let me see. So I know poor Dr. Sibu is in the dark in a thunderstorm. Hopefully you can come back.
While you try to get her back, I do have a funny story to tell, if you wouldn't mind. I did promise antidotes. Can I give one?
You can give one. Yes, sure.
Yeah. So when I was significantly younger, probably 15, 16, I hope my mother's not on here, but experimenting with sort of sexting with a friend, I distinctly remember I wasn't the one actively involved in the sexting conversation, but you know how friends like to ask for guidance on, like, what should I say in response to this? What's the appropriate thing? And the moment that I learned that a vagina should not be dry was when I told her, in response to a message she received from this guy that she was then engaged with, she had said something along the lines of, I'm feeling quite wet. And he had said, well, what should I do about it in response to that? And hear me, innocent, not having had a sufficient physiological sex education, what do you think I said? I said, well, I think that you should tell him that he should wipe you dry. Ladies and gentlemen, that is when I learned that that was the wrong response, and have since then been quite happy with the state of a wet vagina.
Oh my goodness, yes. I mean, I guess I'm assuming there's probably many a story of that kind of, that exact level of information, because especially information from shared with peers who are teenagers. Right. I mean, exactly. I got another request from Dr. Sibu trying to join. Let me try and see if I can ask her to join, and then I'm going to move over to you. Sorry, unfortunately, I can't outsource any of the tech stuff. I've got to do it myself.
Doing so great, Jules.
I thought I was, but now we've been hit with this little a roadblock. Where are we? Now I can't even find her.
I'm loving the comments. And I mean, let's be real. How many of us learned a lot of our first sort of real sex ed beyond just the physiology from those kinds of encounters with our friends? I mean, it wasn't something that we normalized and spoke about enough beyond this is how it works, and then and by the way, don't ever do it. I appreciate that things are different now, and perhaps we can learn from alternative sources than the ridiculous co-sexting experience.
Absolutely. Okay, while we are, right, team. Thank you so much. I'm going to try and get my guests back on, and we're going to see if we have better luck. Part 2.
Oh gosh.
Hello.
Not sure what happened there. Hi guys. I'm
The
really
most
not
stressful.
sure what happened there.
Don't worry, I've asked the wonderful, kind people of the interwebs to come back, to us if they can, and they are coming. They're
Thank
coming.
you, guys.
So that was a whole. I think I have been sweating buckets under here, just like
Yeah.
Okay.
And I could see you, but yeah, there was no connection.
I know you were frozen on our end, and like as we'd last seen you.
Yeah.
So thank you so much. Please come back, everyone. I've said to everyone we're giving them a 1 or 2 minutes comfort break. No one is frozen. Let's get back into it for the second part. Hopefully we'll be posting it now as part 1, part 2. Hello, baby, sleep the night, Steph. Hello, cats. Hello, people coming back. Thank you so much for bearing with us. Technology is not
sorry. Yeah.
friend,
Yay.
but
Thanks, guys. Thank you.
Thanks so much. Yay, les dejo. Thank you, and waving to all of you. You came back to make me so happy.
Thank you.
Like that's the relief of like, oh, I didn't know I was holding my breath. Okay, so just one of the things we were talking about just before we left is the kind of Kayla test was giving us a really I think you said something really quite profound, which is that after you've had a baby, sort of we're talking about the effect of intimacy, sex drive, how you kind of feel after having a baby. And I think the narrative that is definitely popularized online is the one of feeling quite touched out, which is a very true narrative. I had personal experience with it, feeling like I had a baby that was breastfed what felt like 24/7, and a toddler who was only 1 year older jumping on my back, and I felt quite touched up. But the other option is also the other side of the spectrum, should I say, is also something that maybe because of our kind of complexities around how we view women's sexualities, that like a mother who has a sex drive that is potentially active can also be shamed. Like you can feel like if you be shamed by society if you've got a low sex drive, because then you're unavailable, you sort of take chosen motherhood of your partner or whatever it is. If you have a high sex drive or a higher sex drive and you're a new mom, then like, gosh, what's wrong with you? And don't you have a television at home? And like, all those kinds of things you get. There are like moms who have like quite a few children who are young. There's that judgment, don't they watch TV? Like, So yeah, I mean, I think it's just really important, to have this conversation where we can say there is a spectrum, right?
Yes.
Of grads. But I want to kind of go. So we had a few comments that came in, or questions that came in anonymously, and one of the mums, and let me not misread her words. Let me see if I can pull up the thread. So she basically said, okay, there's a few of them on this theme of this kid is 6, libido never returned, new normal, no partner right now, but I'm scared to meet someone in case it doesn't change. So she gave birth 6 years ago and feels like it's completely impacted her libido. What are the factors? Could there be a, Kayla was speaking about some of the ways, like the pathways to intimacy, that maybe your needs aren't being met, and it's like a different kind of, you can't just switch up like that. But could it also be physical? Could there be like a hormonal or like a physical kind of complication or issue that could be causing that?
Yeah. Okay, so I'll just go a few steps back from where you started. So I think in general, as women, we are sort of taught to not be like sexual beings, to not be open about our sexuality, and to not vocalize wanting to have a sexual experience or having a healthy libido. It's like that's not good, it's associated with a sort of a bad vibe if you have a healthy libido, and we taught that you're not supposed to, and if you are, you shut up, don't tell us about it, don't talk about it. So which really isn't the right way of looking at it, because we are sexual beings, and I mean, we're all here because of, sexual intercourse. We all have our babies because we went through that. So sex is part of, who we are, is part of how we express ourselves. And it should really be normalized. Obviously, we do it responsibly, you know what I mean? But it should really be normalized. And so, as you correctly mentioned, that even after having children, it's like you're not supposed to develop any or have any intimacy with your partner. It's seen as taboo. I was just saying to one of my friends this afternoon that I can't judge Rihanna, because I mean, I did the same thing myself. I've got 3 kids, and the age gap between my last 2 is 13 months. So I really have no business judging Rihanna. But people do judge you if, you've, like, when I had my pregnancy after the last one, people were like, is it still the same? Like, and you made to feel awkward even about the choices. And for me, it was a choice that I made because of the difficulties I was having with my pregnancies, and I wanted that portion of my life to be done. So you don't know what drives people to make those types of decisions. You don't, so you shouldn't really judge. And anyway, back to the libido. Yes, it can happen that, particularly immediately in the postpartum period, there's a lot of things going on. Your hormonal changes, the introduction of the new whole human being that you have to take care of, that can take some mental adjusting. And even the mental adjusting is an important part of you being ready. And couples always ask, when is it safe for us, doctor, to go back to sexual intercourse? And that's a difficult question to answer, because it really depends on how you're going to respond to everything that's going on around you. It depends on the complications you may have had during the delivery. It depends on what, if there was any episiotomy, if you delivered via cesarean section. So all of those factors come into play, and we cannot say this is the time to safely go back to sexual intercourse. Generally, we choose 6 weeks because after 6 weeks, your hormonal levels should have gone back to pre-pregnancy, what it was. And if you've had a cesarean section, by that time, you should have healed. If you had an episiotomy, by that time, everything should have gone back. So, generally we'll say 6 weeks is the safest time, because it covers most of the complications that could have happened. By that time, they should have been healed, or, you should have gotten over whatever hurdle that you faced. And even mentally and emotionally, by that time, things should have settled down. But of course, it's different for every person. Some people take longer to heal, even physically. Some people take longer to adjust mentally and psychologically to the new member of the family, and the whole dynamic shift that comes along with having that additional member in the family, So there is no one answer that we can say, this is the time, but it just depends on your situation and how you've adjusted to it.
So thank you so much. With that in mind, one of the other questions we got was, had a baby 5 weeks ago, feeling sexy, but told I have to wait a few more weeks. Do I have the green light to vroom vroom?
If you have no issues, because obviously if you have an episiotomy, it will be sore. It won't be a nice experience for you. So if there are no physical issues, vroom, vroom away, please.
I think, Jules, if I can just add to that though, and I mean, this is so important, what does vroom vroom mean to you? Because let's also remember that the female orgasm, for up to 65% 95% of persons does not happen by means of penetrative sex. So let's remember, are we talking about ready to vroom vroom for my pleasure as a female, or are we talking about ready to vroom vroom because my husband is getting impatient? And that's an important awareness to bring into the room, because vroom vroom can mean something different for each of us. And again, if we normalize that, we'd probably have a little bit of a better time in the bedroom, wouldn't we?
Absolutely. That is, I mean, I think it's so true. I mean, even just having this conversation and prepping and reading in my obviously I've got the answers, I think, in my head, but it really is with a particular narrative of what intimacy between specifically maybe a heterosexual couple would look like. And I think there's so much that needs to kind of be reconsidered in this conversation, but it can't be if you're not having these conversations to kind of normalize this. I want to kind of go, we had a number. I'll do some rapid fire. If you've got a rapid fire kind of medical question that you want to ask Dr. Sibu, that's like a quick answer. And I know we kind of got cut off doing that in the first round. Please do put them in the comment boxes. There's another, so we had vroom vroom, another word that was here was the kloof kloof, which I hadn't heard of as well, which is for someone who's pregnant, going back, Peggy and keen for kloof kloof. Sister told me I'll get an infection and birth early. 7 months now. Do I wait? Poor hubby, also so confused.
Oh, shame.
Rapid fire
So
one.
a lot of people, unfortunately, my medical students, they actually love to say that they tell all the they tell all the pregnant women not to have sexual intercourse in the second trimester, which is not completely true, you know. So it's only for women who are at high risk of getting infection or who have previously had preterm birth. Then those are the patients that we would advise to not expose themselves to sexual intercourse. But in general, in the first trimester, a lot of women actually don't even want to have sexual intercourse because of the hormonal changes that have gone on. You're feeling so sick, you know, there's so much going on with you that you don't know whether you're coming or you're going. So a lot of women end up just not being interested at all in having any intimate relations with their partner. And then comes the second trimester and going into the third trimester. And at that time, you get like your sort of sexual peak, your increased libido peak during that time. Like when I was pregnant, I would like really call my husband up. Am I going to find you at home when I get there? Because like, I'm like up there, you know? So a lot of women in the second trimester, they at their peak of their libido, and you know, you want to be intimate with your partner, and it's good. A lot of partners, I find sometimes they are scared to actually be intimate with you because they don't know what it's going to do to the baby. They're so, you know, unsure. So it's good to talk about these things, and you must ask your doctor as well when you go for your visit, is it safe to have sexual intercourse? So, and where there's no issues, it's absolutely safe to have sexual intercourse right up until the third trimester. In fact, when couples come and they're in the third trimester, they're 39 weeks, they're tired of the pregnancy, I always say, then go for it, because even that intercourse, the physical intimacy and the release of some of the products that are in the semen will actually cause prostaglandin release, which begins labor. So how it started is how you can end it as well. That's what I always say to them. So if you're tired of, you know, being pregnant, just grab your partner and just go for it.
You can kloof all the way up to pregnancy, and you can vroom also a little bit earlier, depending on how comfortable you are and what vroom vroom means to you and what kloof means to you. I remember my husband is going to be mortified but I remember when I was pregnant with our youngest, him like he kept saying, you know, the visual of like the kind of your kids and like you just imagine our unborn child. It's like, what's this thing coming at us?
Oh my goodness.
I know. Where's our unborn child?
Yeah. I think that's what a lot of guys actually picture. And there is, I mean, the muscle of the womb is so thick, it's protecting the baby. The baby is so far away that nothing, will come that close to the baby. Except, of course, I must say, in certain specific medical conditions where you've been told that you're not supposed to have sexual intercourse either because the placenta is too low, or you've had maybe a cerclage, or whatever situation you may be facing. Like I said, cases that have had preterm births in their previous pregnancies, then we don't advise those patients to, obviously have kloof. Is it kloof? Am I saying it right?
Got you. We're gonna, I think it's gonna be something we will not be forgetting. Thank you. That's really helpful, and I think it really speaks around communication as well. Having communication with your partner, but with your healthcare provider. So we can have those questions. And I'm gonna come back to the healthcare provider piece, because I think. I think it's really important to really prepare well for seeing a healthcare provider, whether we're pregnant or postpartum, whether we're uncomfortable, how do you know when to reach out? Just coming back to you, Chris, I want to speak about so we've talked about the kind of in your mind and your body kind of needing to reimagine what intimacy and what sort of sexuality, what it means to you, and to be comfortable expressing that for yourself, and that it might look like, what it looks like for me could be different for you, and we need to be okay with that. I want to speak a little bit about, because we spoke about, this conversation is called Motherhood Embodied, and the reality is that journey through motherhood, specifically the transitional moments, pregnancy into the sort of postpartum phase, your body does change. And on your breasts change. They can look very different pre and post baby. Stretch marks, body shape changing. Gosh, I mean, my feet grew a size in pregnancy. There's just so many different kinds of changes, and so we have that reality. Everyone changes differently. And then we've got, I guess, what I refer to as a body positive movement that we see a lot online. And I wanted to get your thoughts on that, because whilst and I'm going to be honest, speaking totally from my own perspective here, I totally get the heart behind the movement. And I've seen some influencers, some content creators doing some incredible work, normalizing stretch marks, normalizing, breasts that have a bit more elasticity. But sometimes when you label something as inherently positive, it can unintentionally be quite toxic, because if you don't feel positive, if you oh dear, I know I'm supposed to love these tiger stripe stretch marks, or I'm supposed to love my soft belly, but I don't, it can sometimes make you feel even more ashamed than you were to begin with. So what is your take on, the body positive movement? Is body positivity, I guess what I'm asking is body positivity what we should be striving for as a generation of mothers who kind of, want to be kind to ourselves?
Sure. This is such a loaded question. So I think I want to take it a step back, and I want to ask, without the influence of social media, positive or negative, right? The voices that influence how we should be feeling about our bodies. I want to ask where your first reference of shame associated with your body came from. Because the reality is, from a psychological perspective, often that guilt and shame is not an inability to follow a movement, but it's pointing out a deep-rooted shame that is far, far deeper embedded than any large quantity of photographs of multi-fluctuated breasts can ever change. And I know that I'm not really answering the question, but the reality is that we're trying to normalize bodies of different shapes and sizes. That in its core is a good thing. Our response to that, whether we can get on board with that or not, depends on, again, our socialization and our first impressions of our bodies. For me personally, I think that what actually frustrates me about the movement is that it feels quite volatile and quite violent, quite intense. And so you can almost be overstimulated with exposure to bodies. Let's remember that everything needs to be in measure. Otherwise, it does trigger you. So I think something that I could say that I could see a lot of people saying is that it feels like too much too soon, and we're not actually conscious of how we ask questions in a less aggressive way. It's like the equivalent that I compare it to is when you go into a school and you see that the life orientation curriculum is doing sex ed with them, and they're doing the section on STDs, and the teacher thinks it's a good idea to show them lots of delicious photographs of syphilis on the vaginal area and on the penile area, right? Guys, it doesn't work, right? It's too much too soon. So I think there's like a psychological question that I want to ask, like where is your narrative coming from, and why then has that triggered you so much? But then a conscientiousness that you almost have to curate or tailor your content, right? I have bodies of all shapes and sizes. I don't just have postpartum bodies on my feed, because that would feel too volatile and too violent, and it would perhaps move beyond the point of acknowledging healthy exposure versus an awareness that that is a kind of body, and I can enjoy that, but I can also enjoy and ascribe to other maternal body developments, like for example regaining a certain level of ab coverage. Like, it's not bad if you then do not proudly wear your postpartum body on show. You can still want something up, but in measure. I hope that helps. Complex, multi-layered question.
Yeah, no, I think it does. Like, I'm just aware that, you know, as you said, not everyone is willing to put this is me, proudly free, you know, mom on social media. And sometimes it does feel like the current trend requires, like, you know, be authentically yourself, you know, no shame, like free the boob, free the nipple, whatever it is. And maybe, like, you know, your personal preference does not ascribe to that. And in the same measure, you know, I don't want to minimize that people could be sitting with very real challenges about how they feel about their bodies, you know, 2, 3, 4, 5, 10 years postpartum, that saying a positive mantra to yourself every day might not be sufficient to fix, might require actually, like, potentially, you know, seeing someone to assist you with, you know, those feelings. So I guess I mean, thank you. You answered that perfectly. I think it is complex.
And yeah, if I can just add, I think the other thing that you often don't see is that these people have had to work very deep and emotional processes in order to get to a point where they can be public with their body. I mean, what you're seeing is often the result of hard work, right? That's often what we're seeing when it comes to social media. Things are still curated, things are still adjusted, but there's also a story behind how somebody got there. And so I want to say, if you are somebody who wants to get to a point where you can experience pride in your body, just remember that it is not as simple as taking a photo, applying a filter, and adding a mantra. There is extensive therapeutic work that goes behind that. I do a lot of work with self-esteem in teenage girls, and we do the 30-day photo challenge. I'm sure you're familiar with it. It's the concept of I take a photograph of myself at the exact same time every day, and I have to look at that photo irrespective of what I'm wearing or how I'm feeling, and I've got to find one thing that I like about myself. And what that does is it actually psychologically changes your neurological pathways, so that by day 30, you actually realize that, look, I'm a sexy beast, for lack of a better saying, but that is a psychological rewiring of the brain, right? It's taking the commitment of positive feedback and affirmation from me, not from somebody else, not from social media, and making my narrative the most important one. And if you look at the neurological evidence, you can actually see, like, neurological pathways similar to that of a hiking trail that you walk down over and over again, getting thicker and wider. That is a psychological process that somebody has to go through day in and day out to reach a point where then they can maybe pose nude, or they can put their postpartum body on display. Like, just remember, there's 30 days work at minimum behind what you're seeing.
I really love that. If I can just come in, I'll actually take it and I'll use it share it with my patients as well, because I always say to them, don't say stuff like, I'm fetching my body, I'm looking back, I need to, what's this expression? I can't remember the expression that they normally say, but to say that I need to go back to that weight or that size. And I always say to them, you are a mother, you are something you were not before. You may go back to the same size, but things will not necessarily, let's not look for something that, you might be disappointed with, because your body cannot be the same after you've been pregnant for 9 months and delivered a whole human being thereafter. So the body cannot necessarily go back to exactly what it was, you know. And I encourage, I'm into healthy living. Some people call me a health freak of some sort. But I enjoy it. I'm into healthy living and exercise and all that. So I encourage people to go and exercise and for yourself, but don't necessarily look to go back to that body that you had before, because I think most of the time you'll just be setting yourself up for disappointment, because it won't necessarily go back to exactly the way it was before you had a baby.
Absolutely. And I think reframing, body positivity, maybe it's like to body acceptance and acknowledgement of kind of the journey, as you say, that your body has journeyed through and will continue to journey through, right? Because I don't know, maybe in a few years' time we'll have the conversation around next stages and what happens as you get, older. Things, there's different life cycles that women go through. We've had a few other questions that have come through, and some of them speak to look here. So we've had our vroom vroom and fluff fluff earlier. So, okay, here was one on a traumatic birth. So, had a traumatic birth and got stitches. Part of my vagina feels numb and uncomfortable. Is there anything that can be done? Gave birth 18 months ago. So, before we answer that, Dr. Sibu, I want to kind of speak around what physical condition warrants the care of an OBGYN. And I guess I also want to kind of contextualize that one step further. So this is quite a big question, sorry. But and say, if you have access to private healthcare, you have a little bit more direct, so if you were my doctor and I was concerned about maybe burning sensation during sex or discharge or something that's not considered life-threatening but is impacting my quality of life, I could book an appointment with you. We know for women accessing public health care services, sometimes that feeling it's not necessarily the same. People, it's not a pleasant experience to necessarily go and seek out healthcare, but I wanted to kind of get your thoughts on how do we, what is the advice for women? Because for me, this feels like a statement of worthiness, that it's actually not okay if you are having very uncomfortable, if your body is causing you discomfort, even if it's in the context of sexual intimacy, that is something worthy of care, and yet sometimes our healthcare system doesn't provide those parameters. So I guess maybe starting with private healthcare, how do I know if I want to see you? What are the kinds of issues that we can come to speak to the doctor about? And if you are making use of the public healthcare system, what needs to shift to make that friendlier for moms, or how do moms navigate that, and can they?
Yeah. So, I work both in public and private right now. And yes, in private, you can go and see your gynae for any condition, for anything, absolutely anything. Anytime you need to see your gynae, you can make an appointment and book and see the gynae. But in the public sector, yes, there are disparities. For you to be able to see like a gynae, you need to have like certain specific conditions. You can see primary healthcare trained sisters at the local clinic who are trained and educated to help you with that condition. So simple things that are sort of at that level, like discharges, they are trained. But if it's recurrent and it's becoming a problem, they do upscale and refer you to see a see a doctor. Firstly, you'll see like a medical officer, and then if the medical officer fails, then they refer you to see a specialist. So it's a stepwise kind of approach. The service is there, but you just need to go through, all those different levels. You can't just go and see a specialist directly, unless if you are someone who's attending a regional or tertiary hospital for other conditions. If you've got a heart condition, for example, or you've been diagnosed with hypertension in pregnancy, then you can sort of slip it in that you've got that discharge and we're seeing you for this and so forth, and then we get to help you. But just to start from, unfortunately, it doesn't happen. Those are the disparities, unfortunately, in our healthcare system.
Mm-hmm.
But the sisters in the primary healthcare clinics are adequately trained to assist you and to know when to refer you, if the need arises.
So from the mouth of a doctor, if someone is sitting at home watching this, and they do make use of the public healthcare system, that's their sort of primary site of care, and they're sitting with something uncomfortable, potentially discharge, or I don't know, it could be a number of things. What would you say to that person who's literally watching this right now?
Yeah.
What's their first step?
Then they must just go to the local clinic, say their complaint, what it is, and if it's something the sister will be able to handle. Sometimes in some clinics or some hospitals, there are doctors even there that can see to them immediately. So it just depends on what level of care that institution is. So please, if there's anything that's bothering any woman, and I know especially with vulval growths, a lot of women are so scared to go and seek help until the growth is this big, when it started out as just a pimple. And sometimes those can be quite, dangerous. So don't ignore even warts, simple things like that. Don't ignore them until they transform into something bigger than what it actually is. So if you are listening to us and you've got something that's bothering you, there is no shame in anything that is pathological, that is a disease, just because it's in the vagina. It could be a growth that's in the neck, but it just happens to be in the vulva or in the vagina. Seek help, please.
Absolutely. Oh, thank you. That's incredibly powerful. And I really hope that anyone listening to this will take heart and follow this advice. I'm aware of time. I'm hoping that people have been a little bit gracious because of our technical challenges in the middle. I wanted to ask just a quick question, last question for you, Katie. You mentioned the 30-day photography project, which I think I'd love to, if you can share more information with us, we can share it. But mothers who are struggling at this point, maybe you're watching this and you're feeling a little bit disconnected, like you don't feel like you have any sense of what your libido is right now. Where are you on the scale? Or, you feel kind of just, you maybe put yourself last on repeat and are struggling to kind of feel connected to your own body. What is a step that someone watching this tonight could take to begin the journey of sort of reconnecting with their bodies?
Sure. So I think often what I recommend is most helpful is to externalize it, and whether that is by means of talking to somebody else or externalizing it through journaling or voice noting yourself or doing something along those lines. The reality is our brain holds a lot of power, and one of the ways that we reduce anxiety, stress, and reduce the power of thought over us is by giving a verbal experience to it. And so you'll often feel a large quantity of release as well as relief when you acknowledge something that ends up being verbal, right? So I would encourage you to acknowledge it. And often what you'll find is once you've acknowledged it, you'll find the strength to then figure out what your next subjective steps are. And they are so subjective. In terms of sort of your own trajectory towards loving yourself, a lot of the key sort of factors that contribute to us slowly forgetting that we're worthy of love is that we prioritize everybody else except us. That's a huge part of the maternal narrative. And so I think something that I'd like to challenge everyone on that trajectory is whatever you need to do, no matter how small or big, I want you to do something that puts you first. And that could be eating a chocolate now. It could be demanding a day without children. And it could also be something along the lines of going and buying yourself lingerie, because I'm going to be real, my favorite thing to do is put my lingerie on and then my slack pants and my baggy t-shirt and clean my house. But what I've done is I've added something that points to my worth and connection to my intimate womanhood, whilst then being the practical diva that I know I am. So externalize it as a first step, and then do something for you. I think those are the stepping stones. And of course, there are so many subjective steps that then come from that.
Thank you, Katie. That's, yeah, sure. Just do something for you. I love that. I realized I missed a question further up, Dr. Sibu. So maybe this is one of the last ones, but it feels like I might be like starting something new and then saying, okay, life's over. The question was, and I'm very curious about this too, because vaginoplasty, is it only done for medical reasons, is the question. So would you mind just giving us in a quick, what is vaginoplasty? Is it something that's becoming more popular? Is it ever done for medical reasons, or the cosmetic only? And yeah, who gets them and why, and are they worth it?
Okay, so it can be done for medical reasons. Okay, vaginoplasty, it's a surgical procedure where you do work to sort of reconstruct the vagina. It could also be involving the vulva in some instances, depending on what work you're doing. So it can be done for medical reasons. Actually, a few years back, I was working with a urogyne at Gray's Hospital, and and one of the procedures that I really enjoyed working with him on was where we I can't say reconstructed a vagina, but it was like we saw a patient that didn't have a vagina at all. She was born that way. So there are patients who can be born without a womb, without fallopian tubes, without any of the female genital tract, but they have ovaries. But in their development, it just didn't develop. And so we had to reconstruct, create the canal, and elongate it, and stitch it onto the peritoneum from the inside, and close it such that it's a pouch like that. So we make it into like a real vagina. So that's neo vaginoplasty. So it wasn't there, and we constructed it from the beginning, basically. So it can be done for cases where, you know, a patient either has a short vagina or just a dimple, and you create the vagina. So that's for pathology. And then in cases where there are certain things that maybe a particular woman doesn't like about her vagina, so sometimes you find that the vulva is, which is the outside now, the lips, they're not equal. The one is bigger than the other. There can be instances where it's really disfigured, and even medically we want to sort of correct that, because obviously that will affect the patient's mental state and her confidence, and, you know, how she relates sexually as well. So that's still pathological. I mean, it doesn't harm her in any way. It doesn't prevent her from performing any of her sexual not abilities, but like any sexual performances that she wants to do, anything that she wants to do. But it's mentally and psychologically affected her, so we correct that. And then there's the other end of the spectrum, where physically, you know, you as the doctor can see nothing wrong, but the patient herself feels, I don't like this, I don't like that, and I want to change this and change that about my vagina or my vulva. And in all three cases, we can do all, but we are obviously more careful with the one that I've mentioned last, because while it's important to make sure that every woman is confident and happy with herself mentally, psychologically, and physically, it's also important to just balance things up. So, you know, you want every woman to be confident and to be comfortable with herself, but you also balance it up with ensuring that she understands the reality of herself, and she's in touch with herself and who she is, and that her confidence now is not going to lie in always changing this and changing that about herself. But there is room to do work, to do a vaginoplasty, of course. But so long as psychologically it's not like a way of maybe just expressing certain psychological vulnerabilities that she may be having at that point. So it's just a balancing act, but it's not to say that every person who does a vaginoplasty, there's some psychological, you may simply really just not like how your vulva looks and you just want to reconstruct it, and there's absolutely nothing wrong with that. Or you may feel you need...
It's also, it's not like having an injection. It's not like, it's not a minor thing, right? It is a surgery on a very sensitive part of the body.
Yes, absolutely. But newer methods, you don't necessarily have to undergo like surgery. It could be done like via laser. There's newer methods of doing it which are easier, more accessible, more user-friendly, if I can put it that way. But, you know, it's just maintaining that balance. Like you said earlier, Tess as well, that too much of anything, you know, can never be good. Too much exposure of anything and too much of doing anything cannot be too good. So it's just a balancing act.
So much. I am so aware that you've been so generous with your time, and we've gone over, but we did have our little technical glitch in the middle, so I think we've made up for it. I know there were a bunch of questions we didn't get to, but I'm hoping we covered some of the kind of main themes. And maybe just to wrap it up this evening, in just sort of one or two sentences, a parting sort of message or a word of encouragement for mums in the transition. You know, what would you say to the mums if you could, you know, if you could see or put their cameras on and they were listening, when it comes to, you know, feeling embodied in your own motherhood body. Katie, can we start with you?
So I think a very, very key take home that I have for everyone is to understand that if you don't mourn the body that you once have, you can't make room for the beautiful body that you now have, nor will you make room for the body that you will have in future. So be conscious that loss and grief is part of the maternal experience, and that does not mean saying goodbye in a negative way. It says saying goodbye and thank you while simultaneously creating space so that you can embrace what your body currently is.
I love that. Dr. Sibu, last words of encouragement or last thought from you?
So for me, it's to enjoy every step of the way and be present in every moment that you are currently in or that you're going through. Be present as a mother while you're sitting, a new mom, sitting with your baby and feeding that baby, whether it's formula feeding or breastfeeding, or you're just putting your baby like from skin to skin. be present in that moment. And when you move on to do something else, when you move on, maybe you going now to just enjoy time with your partner, also be present, be fully present, and just leave everything aside. So when you're having time with your partner, just get in touch with him and just forget about everything else, because that's an expression of who we are. You know, we are not one thing. You can.
Oh dear, have I frozen? Oh, we were so close. We were so close. Shame. Sorry, Dr. C. We're cutting your internet. It's not me. It's the internet cutting you off. But I think we got the gist of your final thought, to be present. And I think my parting kind of thought, just listening to both of you, is just that a reminder that there is support and care available. There are resources available. There are people that we can see. And so reach out. I think we need to, reach out, speak to a friend if you're unsure, and then seek healthcare support, seek therapeutic support. It is out there, and I'm hoping that people, that the people listening, all of us, that we feel that we can sort of ditch the shame and really just sort of empower ourselves to take to kind of get the answers that we need, because we're worth it. I think that's the main thing, is that what you're sitting with, the niggle that we're sitting with, the discomfort, we don't have to accept that as the status quo. We can strive to feel more sort of at home in the body that we're kind of living this life through. Kayla, Tess, thank you so much for joining us. Dr. Sibu, if you're able to listen in, thank you so much. It's been so wonderful. And thank you to everyone who's tuned in. I saw so many names coming through. So thank you so much. This has been a wonderful way to wrap up a Monday night. And we will save this on our Instagram feed. So send a link to your friends, and we'll upload it to some of our other platforms too, so you can watch it and take more notes. Kayla, Tess, if someone wants to reach out to you, can they at you on Instagram?
Yeah, so my intimacy and couples work don't happen on my personal feeds. They happen at my practice brand. So that's at the Connect Group ZA. And we're on both Facebook and Instagram. And then, of course, you can look us up, www.theconnectgroup.co.za, if you want more information that way too.
Fantastic. And everyone's tagged here. Dr. Sibu's tagged here. So reach out to them if you have another question. But thank you so much for your time, and have a good evening. Bye, everyone.
Yes.